Hello and welcome back to Pharma Mastery Hub. If today is your first time, you're welcome. This is a place where pharmacy meets mastery. Today we'll be looking at the ophthalmic solution, TETRALLERG eye drop. What is the composition of this drug? TETRALLERG contains anthazoline hydrochloride, which is a rapid-acting antihistamine. It contains tetrahydrozoline hydrochloride, which is a vasoconstrictor. It also contains zinc sulfate, which is an astringent with mild antiseptic and protective properties. Remember, we did anti-large earlier. If you've not watched the video, you can check it out. So what's the mechanism of action of TETRALLERG? TETRALLERG employs a triple action mechanism to target the symptom of allergic and irritative conjunctivitis. Remember, anti-large uses a dual mechanism. So let's look at how the mechanism works. Antazolidine competitively blocks H1 receptor on the conjunctiva cells, preventing histamine-mediated responses such as itching and edema. Then tetrahydrozoline, which is a vasoconstrictor, it stimulates the alpha adrenergic receptors, and when it does that, it causes vasoconstriction, and this will reduce swelling, right? Then the zinc sulfite in TETRALLERG, it acts as an astringent. It's an astringent, so it acts as a mild protein precipitant. It forms a protective layer over the conjunctival epithelium by coagulating surface protein. This helps to reduce mucus secretion, provide a mild soothing effect, offer weak antiseptic activity against surface bacteria. Mind you, this is not an antibiotics. The zinc doesn't act as an antibiotics. What are the uses of TETRALLERG? It is used for allergic conjunctivitis, particularly where itching and redness are prominent. It is used for ocular irritation caused by environmental factor. It is used for non-specific conjunctival congestion with associated discomfort. Remember, when we were talking about anti-large, we mentioned where it comes in. We broke it down, so if you've not seen the video, you can look at it clearly so that you can see the difference. Anti-large contains two active ingredients, while TETRALLERG contains three. Dosage and administration: TETRALLERG is administered 3 to 4 times daily or as prescribed by the doctor. If you are a non-healthcare professional watching this, please ensure that you consult your doctor before you use any drug. And if you are a healthcare professional, you already know what to do with this information, and so please ensure you always use it right. Contraindication: hypersensitivity to any of the active ingredients. If you are sensitive to antazolidine, tetrahydrozoline, or zinc or its preservative, do not use it. If you have narrow angle glaucoma, do not use it. If you have dry eye syndrome, do not use it. And for the dry eye syndrome, the zinc may exacerbate the dryness and causing further irritation. Remember, when it comes to drug, your doctor might prescribe a particular drug, and it's usually based on benefits outweighing the risks. What are the precautions and warnings? For ocular irritation, zinc sulfate can be perceived as stinging more than the standard drops. I have seen someone who experienced that stinging sensation, and because of that stinging sensation, the person has to stop. It is important to note that TETRALLERG has the capacity to cause that stinging. Then, but if it is consistent, if it persists, you can disuse it and contact your pharmacist or doctor. Prolonged use, overuse may lead to rebound hyperemia, same as anti-large. Now, for pregnancy and lactation, the safety is not established. You only use it if it is clearly needed. This is where the benefit outweighs the risk talk I was saying earlier comes in. For those using contact lenses, remember, you have to remove your contact lenses first. After 15 minutes, you can put it back, because zinc may cause discoloration of soft lenses. Then for systemic effects, you use with caution in the elderly. Due to systemic effects, use with caution in the elderly or those with and cardiovascular issues. So what are the advice as a pharmacist you need to give your patient? As a pharmacist, you can tell your patients on the following. You tell them about the zinc factor. Yes, zinc, because this drug contains zinc, it can sometimes cause a brief stinging. You also tell them if they are experiencing discharge, it is good if the eyes feel sticky or have a bit of mucus, because the zinc will help to dry it up. But it is important to also differentiate it from bacterial infection. Now, duration of use, do not use this drug. Tell them that you should not use the drug for more than a few days. If the eyes are still red and sticky after 3 to 4 days, they should see their doctor or optometrist. Then contact lenses too, you tell them, because a lot of persons use contact lenses and they find it like it's a normal part of their eye, and they don't get to remove it. You tell them so that they get to take it off and apply the drops. Also advise the patients to always shake it before use. So as a pharmacist, this is what you should know. There's a differentiation between, because a lot of people will say anti-large and tetra-large are the same. So why anti-large is dual combination, which is best for pure allergy, redness and itching. Tetra-large is triple action, and it is a better choice when there's discharge or stickiness. Now the zinc dry up the excess mucus, making it ideal for later stages of allergic reaction. Remember, you have to explain to your patient so that they also understand. Now the zinc stick expectation, now you should always tell your patient about the side effects, potential side effects that they might experience, because like this person I was talking about, if she was informed earlier that she will experience some stinging sensation, she wouldn't have stopped that drug. So educate your patients about everything so that the adherence will increase. If you found this video helpful, don't forget to give this video a thumbs up, share it with your pharmacy circle, and subscribe for more. See you in the next episode. Thank you.